After 60, the body begins to speak in a quieter language, and one of the first signals to soften is thirst. What once felt obvious becomes subtle, and the urge to drink no longer rises reliably even when the body needs water the most. This change is not accidental. It is rooted in aging-related shifts within the brain's thirst center, kidney function, and hormonal signaling. At the same time, blood sugar regulation becomes more fragile. Glucose moves through the bloodstream more slowly. Insulin signaling becomes less efficient, and small imbalances that were once corrected effortlessly now linger longer. In this delicate state, hydration is no longer a background habit, but an active metabolic support. When water intake drops, even mildly, blood becomes more concentrated. This concentration increases measured blood sugar levels without any additional glucose entering the system. The kidneys, which play a central role in filtering excess glucose from the blood, require sufficient fluid to function efficiently. Dehydration reduces their filtering capacity, allowing glucose to remain in circulation longer. For seniors, this means that a simple lack of water can quietly worsen blood sugar readings, even when diet has not changed. There is also a neurological dimension. The aging brain responds more slowly to internal imbalances, including rising blood sugar. When hydration is inconsistent, the brain perceives metabolic stress and releases counter-regulatory hormones such as cortisol and adrenaline. These hormones raise blood sugar further by signaling the liver to release stored glucose, creating a cycle that feels confusing and discouraging. What appears to be unstable diabetes control is often compounded by insufficient water rather than poor discipline or worsening disease. Muscle tissue is another overlooked factor. Muscles are one of the largest glucose-absorbing organs in the body, and they rely heavily on adequate hydration to maintain insulin sensitivity. Dehydrated muscle cells resist glucose entry more strongly, forcing the pancreas to release more insulin to achieve the same effect. Over time, this increases metabolic strain and fatigue. Proper hydration restores cellular flexibility, allowing glucose to move more easily into muscle, where it can be used for energy rather than remaining in the bloodstream. Intentional hydration becomes essential because instinct alone is no longer enough. Seniors may drink only when they feel dry mouth or discomfort, long after dehydration has already begun influencing blood sugar. By choosing to drink water regularly throughout the day, independent of thirst, the body receives steady support for circulation, kidney filtration, hormonal balance, and cellular metabolism. This intentionality transforms water from a passive beverage into an active participant in metabolic stability. Understanding this shift is not about blame or fear, but awareness. Aging does not remove the body's ability to regulate blood sugar. It changes the rules under which regulation occurs. Hydration becomes one of the simplest ways to restore balance within those new rules. When seniors respect this change and respond with consistency rather than instinct, they create a foundation where blood sugar control becomes gentler, more predictable, and less stressful on the body and mind. Water plays a quiet but powerful role in blood sugar balance because it directly influences how glucose moves, concentrates, and clears within the body. When the bloodstream is adequately hydrated, glucose is dispersed through a larger plasma volume, reducing sharp spikes in concentration after meals. This dilution effect is not about masking glucose, but about giving the body time and space to respond appropriately. In older adults, where regulatory systems move more slowly, this buffering effect becomes especially valuable, allowing insulin and cellular uptake mechanisms to work without urgency or strain. The kidneys sit at the center of this process. They continuously filter the blood, removing waste products and excess substances, including glucose when levels rise above the renal threshold. For this filtration to function efficiently, adequate water must be present.
When hydration is insufficient, blood flow through the kidneys decreases and filtration slows. Glucose that could have been excreted instead remains in circulation, subtly elevating blood sugar levels. This is one reason dehydration can lead to unexpectedly higher glucose readings, even when diet and medication remain unchanged. Circulation efficiency is another critical factor. Water maintains blood volume and reduces viscosity, allowing glucose, insulin, and oxygen to move smoothly through vessels. Thicker blood creates resistance, slowing delivery of insulin to tissues and delaying glucose uptake. In seniors, whose blood vessels may already be less elastic, hydration becomes essential for maintaining flow efficiency. When circulation improves, insulin reaches muscle and liver cells more effectively, and glucose clearance becomes more predictable and balanced. At the cellular level, water supports nutrient transport across membranes. Glucose enters cells through transport proteins that function best in a well-hydrated environment. Dehydration alters electrolyte balance and cell membrane tension, making glucose entry less efficient. This forces the body to compensate by releasing more insulin, increasing metabolic stress. Proper hydration restores the cellular environment needed for glucose to move where it belongs, into cells where it can be used for energy rather than remaining in the bloodstream. Hydration also influences how the body interprets metabolic signals. When fluid levels are low, the body may misinterpret fatigue or mild dizziness as a need for quick energy, triggering cravings for sugar or refined carbohydrates. Adequate water intake helps clarify these signals, reducing unnecessary glucose intake and supporting more stable energy levels throughout the day. This effect is subtle but meaningful, especially for seniors managing diabetes or prediabetes. What makes water unique is that it supports blood sugar balance without forcing the system. It does not stimulate insulin directly or suppress glucose production aggressively. Instead, it creates conditions in which the body's existing regulatory mechanisms can function more smoothly. For older adults, this gentle support is often more sustainable and less disruptive than intense interventions. When water intake is consistent, kidneys filter more efficiently, circulation flows with less resistance, and cells respond with greater sensitivity. In this way, hydration acts as a foundational layer beneath all other blood sugar strategies. Diet, movement, and medication operate more effectively when water is sufficient. Without it, even the best interventions struggle to produce stable results. By understanding water as a facilitator of balance rather than a passive beverage, seniors can use hydration to support blood sugar control in a way that is natural, accessible, and deeply aligned with the body's physiology.
Hydration exerts a profound influence on blood sugar control by shaping the hormonal environment in which insulin must operate. When the body is underhydrated, it interprets this state as a form of physiological stress. In response, stress hormones such as cortisol and adrenaline are released to protect circulation and blood pressure. While these hormones are essential for survival, they carry a metabolic cost. Cortisol signals the liver to release stored glucose into the bloodstream, and adrenaline reduces insulin sensitivity in muscle tissue so that glucose remains available for immediate use. In older adults, this stress response becomes more pronounced and lingers longer, quietly raising blood sugar levels even in the absence of dietary changes. Consistent hydration reduces the need for this stress-driven compensation. When fluid levels are stable, blood volume remains adequate and blood pressure regulation becomes less reactive. The brain no longer perceives dehydration as a threat, and the cascade of stress hormones is dampened. This calmer hormonal environment allows insulin to work as intended, guiding glucose into cells rather than battling against opposing signals. The result is not dramatic, but it is steady and meaningful, particularly for seniors whose systems are less tolerant of hormonal swings.
Insulin sensitivity is deeply connected to the state of the cells it serves. Muscle and fat cells respond to insulin by opening transport pathways that allow glucose to enter. Dehydration stiffens cell membranes and disrupts electrolyte balance, making these pathways less responsive. The pancreas compensates by releasing more insulin, increasing metabolic strain and fatigue. Proper hydration restores cellular pliability, allowing insulin to act with less effort and greater precision. Over time, this reduces the burden on the pancreas and supports more stable glucose levels. Hydration also influences inflammation, another factor that interferes with insulin action. Low-grade chronic inflammation is common with aging and is worsened by dehydration. Inflammatory signals disrupt insulin receptors, reducing their effectiveness. By maintaining consistent hydration, inflammatory processes are subtly reduced, improving the body's ability to respond to insulin. This effect may not be immediately visible in daily glucose readings, but it contributes to improved long-term metabolic resilience. There is also an indirect behavioral component. When hydration is insufficient, the body often signals discomfort through fatigue, irritability, or mental fog. These sensations are easily mistaken for hunger or low blood sugar, leading to unnecessary snacking or glucose intake. Adequate hydration clarifies these signals, reducing reactive eating and helping seniors respond more accurately to their body's needs. This behavioral stability supports physiological stability, creating a reinforcing loop that benefits blood sugar control. What makes hydration uniquely valuable is that it improves insulin function without forcing biochemical pathways. It does not override natural regulation, but restores the conditions in which regulation works best. For seniors managing diabetes or metabolic instability, this gentle approach aligns with the body's changing rhythms. Consistent water intake becomes a way of calming the system, reducing internal resistance, and allowing insulin to perform its role with greater efficiency and less strain, supporting steadier energy and a more balanced metabolic state throughout the day. The way water is consumed throughout the day can influence blood sugar regulation just as much as the total amount consumed. When water intake is rushed, irregular, or clustered into short periods, it places sudden demands on digestion and circulation. Large volumes consumed quickly can dilute digestive enzymes, slow gastric emptying, and alter how carbohydrates are absorbed in the intestine. For seniors whose digestive systems already work at a gentler pace, this can lead to uneven glucose absorption, causing blood sugar to rise and fall more sharply than necessary. Slow, steady hydration creates a very different physiological response. When water is sipped gradually, it supports digestion without overwhelming it. The stomach empties at a controlled rate, nutrients are absorbed more evenly, and glucose enters the bloodstream in a smoother pattern. This steady entry gives insulin time to respond appropriately, reducing sudden spikes and reactive drops. Over time, this rhythm supports a more predictable metabolic environment, which is especially valuable for older adults managing diabetes or metabolic instability. Timing also matters in relation to meals. Drinking moderate amounts of water before eating supports satiety and prepares the digestive tract without interfering with nutrient absorption. During meals, small sips help digestion and circulation, while excessive intake can dilute stomach acids and enzymes, slowing carbohydrate breakdown and altering glucose release. After meals, gentle hydration supports circulation and kidney filtration, helping the body process glucose efficiently. This balanced timing respects the body's natural digestive sequence rather than disrupting it. The pancreas, which plays a central role in blood sugar control, is sensitive to both hydration status and digestive rhythm. Sudden shifts in fluid intake can create inconsistent signaling, forcing the pancreas to respond reactively rather than smoothly. Consistent hydration throughout the day supports clearer signaling between the gut, pancreas, and bloodstream. This allows insulin release to align more closely with glucose absorption, reducing metabolic strain and promoting stability. Hydration pace also affects the nervous system. Rapid intake can trigger mild stress responses, particularly for older adults, activating sympathetic nervous system activity that works against insulin action. Slow, mindful drinking supports parasympathetic activity, which enhances digestion, insulin sensitivity, and glucose uptake. This nervous system balance is often overlooked, yet it plays a significant role in how the body processes both water and nutrients. When seniors adopt a pattern of evenly spaced hydration, they create predictability within the body. Blood volume remains stable, kidney function is supported consistently, and hormonal signals remain calm. This predictability reduces the internal fluctuations that contribute to fatigue, dizziness, and unpredictable blood sugar readings. Over time, the body begins to trust this rhythm, responding with greater efficiency and less resistance. Understanding hydration as a process rather than a quantity shifts the focus from rules to awareness. The goal is not to drink water aggressively, but to drink it in a way that aligns with digestion, circulation, and hormonal signaling. This approach transforms water into a stabilizing force, quietly supporting blood sugar balance through timing, pacing, and respect for the body's natural rhythms.
When seniors begin to see water not as a simple liquid, but as a form of metabolic communication, their relationship with hydration changes in a meaningful way. Every sip sends information to the body about safety, availability, and balance. Hydration tells the nervous system that circulation is supported, tells the kidneys that filtration can proceed smoothly, and tells cells that nutrients can be processed without urgency. This perspective moves hydration beyond quantity and into intention, where water becomes a daily signal that stabilizes internal systems rather than merely satisfying thirst. Blood sugar regulation relies heavily on communication between organs, hormones, and cells. When hydration is inconsistent, those messages become distorted. The body may interpret dehydration as stress, triggering glucose release from the liver and resistance at the cellular level. By contrast, steady hydration communicates stability. It reassures the body that resources are available, reducing the need for emergency responses that elevate blood sugar. This calm internal dialogue allows insulin to function with greater efficiency and less resistance. Energy levels are often the first noticeable benefit of this shift in perspective. When hydration supports circulation and glucose delivery, cells receive fuel more evenly throughout the day. Seniors often describe feeling less drained between meals and more mentally clear, not because they are consuming more sugar or caffeine, but because their bodies are finally able to use existing glucose effectively. This steadiness reduces the peaks and crashes that contribute to fatigue, irritability, and cravings, reinforcing healthier metabolic patterns. Clarity of thinking is closely tied to blood sugar stability and hydration status. The brain depends on a constant supply of glucose and oxygen, both of which are influenced by blood volume and flow. Even mild dehydration can impair concentration and decision-making, leading to choices that further destabilize blood sugar, such as skipping meals or overeating refined carbohydrates. Viewing hydration as metabolic support helps seniors protect cognitive function while indirectly supporting glucose control, creating a reinforcing cycle of awareness and balance. This mindset also encourages patience and consistency. Instead of reacting to high or low blood sugar readings with frustration, seniors who understand hydration as communication focus on supporting the body daily. Small, repeated actions replace urgency and anxiety. Drinking water regularly, pacing intake thoughtfully, and observing how the body responds fosters a sense of partnership rather than control. This reduces stress, which itself is a powerful driver of glucose instability.
Ultimately, this approach reframes hydration as an act of care rather than compliance. Water becomes a tool for listening to the body and responding with respect. It supports steadier energy, clearer thinking, and gentler blood sugar regulation, not by force, but by alignment. For seniors, this shift restores agency and confidence, reminding them that even simple habits can influence complex systems when practiced with understanding and intention. The most overlooked medicine in aging is not hidden in a pill bottle or a prescription pad, but in something so familiar that we forget its power. Water does not announce itself as treatment, yet every cell that manages blood sugar, every organ that senses insulin, and every vessel that carries glucose through the bloodstream depends on how, when, and how consistently we drink it. After 60, the body's relationship with water changes quietly, and in that quiet shift lies either growing instability or renewed balance. After 60, thirst becomes a less reliable signal, even as blood sugar regulation becomes more sensitive to hydration levels, making intentional water intake a critical metabolic support rather than a casual habit. Proper hydration influences blood glucose concentration by supporting kidney filtration, circulation efficiency, and the dilution balance that reduces unnecessary glucose spikes. Drinking water strategically throughout the day helps improve insulin sensitivity by reducing stress hormones and supporting cellular glucose uptake. The timing and pace of water intake matters, as slow, consistent hydration stabilizes digestion, prevents blood sugar fluctuations, and supports pancreatic signaling. When seniors view hydration as a form of metabolic communication rather than volume consumption, water becomes a daily tool for steadier energy, clearer thinking, and gentler blood sugar control.